Greetings everyone. So the topic of the presentation is epidemiological tools to detect the disease drivers in a community, the evolution of AI in healthcare, and the AI-based prediction of infectious diseases outbreak in a particular community. So the various tools to detect the disease drivers are at particular paces, like describing the spectrum and burden of diseases and healthcare related events in a particular place, determine the cause of the diseases, determine the social, genetic and molecular determinants, test the interventions for efficacy, efficiency and equity, synthesize the epidemiological evidences, contribute to health policy and program planning, and then monitor and evaluate the programs in that area. And the cycle goes on and on. Epidemiological tools are essential for detecting the disease drivers in any community. They help the health professionals and researchers to identify patterns, risk factors, and potential sources of those disease outbreaks. The commonly used tools to detect the disease drivers in the community are: number one, the surveillance systems. These can be passive or active. Number two, the case control studies, which help in comparing the individuals of a specific disease to those without the disease. Its application is that it is often used in investigating outbreaks of rare diseases and identifying the commonalities among them. Number three are the cohort studies. They are valuable in establishing causal relationships between exposures and outcomes and provide insights into the natural history of the diseases. Number four are the cross-sectional studies, which are used in obtaining a snapshot of the health status of a population. Number five, the outbreak investigations. They are critical for managing and controlling the spread of infectious diseases during the outbreaks. Number six, the geographical information systems. They integrate the spatial data to a map and analyze the disease patterns within the communities. It understands the spatial distribution of diseases, plan resource allocation, and identify high-risk areas for targeted interventions. Number seven, the molecular epidemiology. It involves the use of molecular techniques to study the distribution and determinants of a disease. Number eight, the serological surveys. They measure the presence of antibodies in a population to determine the prevalence of past infections. Number nine, risk mapping. It involves the use of statistical models and data visualization techniques to identify areas of high risk for disease transmission. And number 10, the sentinel systems. In the sentinel systems, we focus on monitoring specific populations or locations known to be early indicators of the disease activity. Number 11, the syndromic surveillance. It involves monitoring non-traditional data sources, for example, the emergency department visits and the pharmacy sales, for early detection of outbreaks. It involves the patterns of symptoms rather than the confirmed diagnosis. Number 12, the social network analysis. It examines the social connections within a community and helps identify the patterns of disease transmission and influential individuals who may play a role in the spread of infections. Number 13, the community health service. It collects the information directly from the community members regarding health behaviors, risk factors, and health outcomes. The survey may include interviews, questionnaires, or focus group discussions. Number 14, the environmental surveillance. It involves monitoring environmental factors such as water, air, and its vectors to identify the potential sources of diseases. Next, coming to the CBS, which is the community-based surveillance. It is a system that directly involves the community members in the detection and reporting of events in a public health sector. It is a versatile and scalable intervention that has been used for detection and reporting of infectious diseases, non-communicable diseases, and monitoring the births and deaths, carrying out verbal autopsies, and containing outbreaks even during the COVID-19. It can provide early case detection and reporting during disease outbreaks and monitor the events of public health importance. The key success factors for the CBS systems include the workers. The success of CBS systems is often attributed to the workers who are responsible for active case detection. The community. The involvement and engagement of the community in CBS systems is crucial for their success. This includes community acceptance of CBS workers, community involvement in the design and implementation of the system, and community ownership of the whole program. Next, the case detection and reporting. Effective use of technology and simplicity of case definitions are the important factors for success of CBS systems. Integration. The vertical integration of CBSE systems with existing health systems, the lateral integration with other CBS systems, and horizontal integration with the public health programs are key to success. This highlights the importance of community engagement, effective communication, rigorous evaluation in the implementation of CBS programs. The findings suggest that investing in community participation approaches and developing and deploying the CBS systems based on known drivers of success can improve their efficiency and effectiveness. However, it is important to balance the burden of CBS systems, particularly in resource-limited settings. Conclusion. The CBS is a promising surveillance modality in the discourse of global health security. By investing in community participation, approaches and developing and deploying CBS systems based on known drivers of success, the efficiency and effectiveness can be improved. Next, coming to the evolution of AI in the healthcare and AI-based prediction of infectious disease outbreak. The various uses of artificial intelligence in public health include disease forecasting, risk prediction, health diagnosis, spatial modeling, public health surveillance, and the pandemic epidemic modeling. The new age of healthcare, the impact of big data and machine learning on healthcare emphasizes the potential and substantial improvement in diagnostics, treatment, and cost savings. It also discusses the challenges posed by the increasing demand for healthcare services and shortage of practitioners. There are various technological advancements which outline the AI and data science, particularly the development of deep learning, its impact on AI tools, and the role of companies like IBM, Watson, and Google's DeepMind in healthcare related applications. The section discusses the various applications of AI in healthcare, including precision medicine, genetics-based solutions, and drug discovery and development. It covers the use of AI in medical visualization, such as machine vision for diagnosis and surgery, and deep learning for medical image recognition. Precision medicine. The document explains the concept of precision medicine, its advantages, and the types of clinical health areas which it encompasses, like the complex algorithms, digital health applications, and the omics-based test. Genetics-based solution. It dwells into the potential of full genome sequencing for precision medicine, the use of AI in interpreting genomic and phenotypic information, and application of AI in drug discovery and development to identify therapeutic targets and develop individualized genetic medicines. Artificial intelligence and medical visualization. It discusses the use of AI in medical visualization, including machine vision for diagnosis and surgery, and the application of deep learning, particularly convolutional neural networks, in medical image recognition. It also touches on the use of virtual reality and augmented reality in surgical training and patient experience. Thank you.